This segment sponsored by Summit Physical Therapy. I am here at Summit Physical Therapy, and today we are going to talk about aquatic therapy, which takes place in the pool, and behind me you'll see Jane. And I'm actually going to chat with Gretchen Espich, who is a physical therapist. Hi, Gretchen.
Hi, Jessica. How are you?
I'm
doing
good.
Well.
So this is fun. We're doing kind of looking at walking on water actually taking place.
Right, right.
So tell me about the aquatic therapy services offered here.
Well, we use aquatic therapy in conjunction with regular physical therapy to help provide people who may not be able to do exercises on land with an alternative so that they can work on strength, mobility, just basic cardiovascular endurance. So all of the things that we're really looking for to be able to move on land, we can help them with in the water in an environment that's less painful.
Yeah, so share with me about some of the benefits of actually getting that type of workout and physical activity inside of the water.
Sure. When you're in water up to about your chest, it takes 50% of the compressive forces off of your low back, off of your knees or your ankles. So for people who have pain with those activities, this is an environment where they can do the strengthening portion of it, but they don't have the wear and tear that you would with like walking on land or trying to go run. The water is also kept at about 92 degrees, so we get some nice joint lubrication, some muscle relaxation. It's a much less painful environment to move in, so people can get more benefit from that.
Yeah, that's so true, because if you think about when you're just out swimming and water aerobics and you're just like having fun, you do feel like it's a workout underwater, but it's just lighter and kind of gives you more, I think, stamina to be able to do more of the exercise.
Absolutely, and the water, you know, because of the density of the water, you actually have to push to move yourself through the water. So we get some strengthening just by benefit of moving through the water itself.
Yes, and the benefit of it being here is, of course, having an in-water treadmill, which is so awesome. So kind of walk us through what Jane is doing in the water.
Well, so Jane's using the treadmill, obviously, but again, you know, a lot of times we'll have people either warm up by walking back and forth or warm up by walking on the treadmill. This treadmill goes up to about the equivalent of 5 miles an hour.
Wow.
So while we can't necessarily run on it per se, we can get that endurance and that strengthening for the legs, but there's a lot less pounding on the joints.
Okay, and talk to me about the clientele that really would benefit from this type of workout.
You know, I mean, it sounds a little all-encompassing to say that there aren't very many that couldn't benefit from aquatic therapy, but we can use it for orthopedic issues like knee pain, back pain, people who have had knee replacements, people who have hip issues, but we can also use it for people with neurological issues because of the properties of the water. It really helps to support a person's ability to move. So being in the water actually improves your developmental level or your ability level by about 1. So say a person walks with a walker, typically in the water, because it supports them, they can walk with just holding on to like your therapist's hand or holding on to a handrail. Or we can have them, like say somebody who, like a child who may only be able to crawl, we can have them actually do weight-bearing things in the water because the water helps hold them up.
Yes, and so as a physical therapist, when you're working with your patients in the water, do you actually get in the water with them to walk them through the steps?
Yeah, it kind of depends on the patient. Some people feel like they've got it, like Jane's got this. So she could be in there and we would just help to guide her along from the sides. But if we have a patient who needs assistance, then we will be in the pool with them. Particularly people who are fall risks or who may feel like they don't feel very steady on their feet. We will be in there with them to help keep them safe. Also, we have a fair amount of people who get in the pool who don't swim.
Right, yes.
So they can be a little nervous about being in, and we're with them all the way.
Okay, okay, that's great. And just kind of thinking about the time of day that people can come and actually do this type of physical therapy, they can do it at any time because they actually don't get their hair wet. Is that correct?
That's correct.
Okay.
Yeah, absolutely. I mean, there are certainly circumstances where we can have them get their hair wet, but I would say 95% of the people coming in do not get their hair wet at all.
Okay. Yeah. So Gretchen, tell me about some of the limitations that people may face as they are thinking if this workout works for them.
Yeah, I mean, the largest one is that we do have stairs that they have to be able to go up to get in. We've had people in wheelchairs who just kind of go up on their hands and their tush. That's probably the largest one. There is some issues with like continence that can be a barrier. That's something that if people have a question like, can I get in, can I not? They're always willing. I mean, we'd be happy to talk to them about that if they call or if they come in. We normally have them come in, take a look at the pool, see if it's for them, and try to figure it out from there.
Yeah, so you have different types of equipment that you utilize in the pool. I see it spread all over. We've discussed this one before in studio, but can you walk me through some of the equipment that you all use?
Sure. So we have we basically are trying to use 3 things to help increase like the difficulty of the exercise itself. One is like the relationship between buoyancy and gravity. So the force of buoyancy is directly the opposite of the force of gravity. So we can use buoyancy like pool noodles or some of the buoy barbells that are kind of like towards the back to try to push down into the water or to step on. We can use that because of the buoyancy. It gives some extra resistance. We use surface area, which is the paddles or those yellow barbells that are back there, because it helps to increase the resistance as you're trying to move that through the water. And then we actually have weights themselves that the patient can wear around their ankles or around their wrist. So yeah, we can utilize all of those things to make the exercises more difficult or easier, as the case may be, because if a person has a hard time lifting their leg up, we can put the noodle underneath their leg. It makes it easier to lift up. Harder to push down, but easier to lift up.
Yes, and I'm sure a burning question is, what is the temperature of the water?
Yeah, the temperature is 92 degrees. So 92 degrees is what the American Arthritis Association says is the best. It's kind of the best of both worlds. It's warm enough to get some muscle relaxation, to help people feel more comfortable, but not so high that we need to worry about it elevating people's blood pressure or their heart rate. So we have to keep everybody healthy while they're in.
Yes, and if someone is interested in learning more or coming in to kind of get an assessment about this pool experience, where should they go?
Well, for most people, they can just call our phone number, go to our website to get in contact with us, and we can get them scheduled for an evaluation. Some insurances require doctor's referral, but the state of Indiana does not. So if you just have a question, you can give us a call. If you're interested in it and you think that this is for you, call our office. We'll make an appointment. We'll evaluate you on land the first time you come in, and then the next time we would get you in the pool if that's what we find is appropriate for you.
All right, wonderful. Thank you so much, Gretchen.
Thank you very much.
This is so awesome. And if you would like more information about the Summit Physical Therapy, we'll have their website listed below, and I'll see you after the break. This segment sponsored by Summit Physical Therapy.